So it really started about 2 years ago. I had a patient come in, a gentleman in his early 60s, had a bad shoulder injury that needed surgery, and he was very worried and concerned about his post-operative pain management. The reason why is he lost his son to the heroin epidemic. And so he was very sensitive to the concept of needing narcotics because that's how his son got hooked. So at that point, I really started diving in and eliciting help from a lot of other people, figuring out what I can do better for my patients, and particularly helping pain after surgery. So with this, I started using a long-acting block. And so a block is injects some medicine around a nerve that numbs up the arm, particularly the shoulder, for a period of time. A lot of the blocks I use now, I can get 3 days out of the block. So with that, you get through the worst part of the pain, and you don't necessarily need the narcotics. So he was the first one I tried this on, and it worked great. He used 0 narcotics, and he was the first patient I've been able to get through a rotator cuff repair with 0 narcotic pain medications afterwards.